Hi, today I've chosen to speak upon the benefits of chemotherapy. Why chemo? Well, because until a month ago I had no clue about cancer. I walked around oblivious to a world where people are fighting for their lives every day. It's one of those situations where you're like, cancer has nothing to do with me, so I'll just pretend it doesn't exist. Well, it has been exposed to me through an important family member. I remember the day I had got that phone call. I had just moved to Odessa and was out buying groceries for my new apartment. The news that my aunt has cancer stopped me in my tracks. Now, this is the aunt that I have tons of pictures and memories of me and my sisters wearing dress-up clothes and spending countless numbers of magical Christmases at her house. The aunt who with every year I grew closer and closer to and formed an inseparable bond. A bond that was so strong it did not waver when she told me she did not want any form of treatment for her cancer. Finding out that my aunt has cancer and is refusing treatment and chemotherapy got me on the tracks to looking and researching different procedures for her cancer. She's a little older, so maybe she just didn't understand exactly all the benefits of her treatment. So these points I'm going to make today are what I would expect a doctor to explain to an uncertain patient with cancer. I'll explain what cancer is, how chemotherapy works within the body, how treatment works, and some of the side effects of chemotherapy. To begin with, many people should understand exactly what cancer is. Cancer is a disease caused by an uncontrolled division of abnormal cells in any part of your body. There are many treatments you can take to help fight off cancer, such as chemotherapy, radiation therapy, targeted therapy, surgery, and many more. I have chosen to speak particularly on chemotherapy because it is one of the most common forms of treatment, and it's like a symbol that most people associate cancer with. Chemotherapy is one of the least invasive and attacks cancerous cells directly. It helps to stop cells from dividing and spreading. Chemotherapy can also attack cancerous cells in any part of your body. As a cancer patient, you may be scared of the idea of chemotherapy because of some of the things you may have heard or seen on TV or from other people. You can take chemo at home or as a pill, and you can also take sessions at a chemotherapy unit through an IV. Now, these sessions depend on the type of cancer that you have and the type of treatment that you need. When I toured the St. Luke's Hospital in Houston, Texas with my aunt, we spoke to a patient. She was on her last treatment and had a total of 8 sessions in a 6-month period. Now, these sessions could last from a few minutes to a few hours. The Macmillan Cancer Support website described what a chemotherapy session was like. During a session, you sit in comfy chairs. You don't feel anything during your treatment, and you are allowed to eat, drink, read, or sleep. You can bring family and friends with you. You could use this moment to relax. Some of the side effects of chemotherapy usually scare people, such as nausea, hair loss, fatigue, or feeling sick. But if you do experience any pains or discomforts, there are things that doctors can do to help counteract these effects. Increased risk of infections does happen, although not everybody experiences these pains, and it does depend on the type of chemotherapy that you have. I also researched some long-term effects of chemotherapy. I found an article titled The Disadvantages of Chemotherapy written by Ray Udon on Livestrong.com. In his article, Ray discussed some of the long-term effects of chemo, including heart or kidney problems, lung tissue damage, nerve damage, and sometimes infertility. Yes, these are some things that everyone deciding to undergo chemotherapy should be aware of, but risks do come with literally everything you choose to do in life. Heart and kidney problems can be managed, infertility can be overcome through adoption or surrogacy, and the chance to live your life with your loved ones is worth these risks. Survivor Sally R. from CancerTreatment.com says she experienced some mental side effects from her chemotherapy, such as a lack of organizational skills and a lack of short-term memory. She's a 4.5-year cancer survivor. I can't really give you any statistics about the survival rate of using chemotherapy because it does depend on the type of cancer that you have and the stage that your cancer has progressed to. But I do believe that these experiences are a small price to pay for a cure and to live your life with your loved ones. Doing a chemotherapy treatment is better than doing no treatment at all. Finding out that you have cancer is not a death sentence. It's a chance for you to come together with your family and friends. And you have to understand that doctors and scientists are working hard to increase survival rates and eliminate cancer altogether. Giving up and having a negative attitude is shown to decrease your quality of life in an article from cancer.org. Tension and anxiety, and depression, these all decrease your mental health, which interferes with a positive attitude. And if you do start to have a negative attitude, it is okay. Cancer is an adjustment. Finding out that my aunt has cancer made me not only think about my aunt's health and her well-being, but mine as well. I could be at risk to have the same cancer that she has. It seems that every time I talk to someone they know or them themselves have been diagnosed with cancer. My aunt having cancer helped me open my eyes to a life that I may not be able to avoid. So learning about these different cancer treatments, such as chemotherapy, will allow me to become more knowledgeable about things that I may have to face or that other people are facing right now. Having cancer, you just need to know that there are family, friends, doctors, and nurses and support groups that want to help you feel comfortable and help you fight cancer. Thank you.